My story really began during my residency. I had actually been drawn to endocrinology. I loved medical physiology, I liked the pathways, and that's kind of where I was headed. And I ended up doing a grand rounds, and I could choose anything I wanted to talk about. And I ended up wanting to focus on populations that were marginalized, and ended up settling on how we marginalize people at the end of their lives. And really thought about this emerging area at the time, which was called palliative care. And after that grand rounds, in the process of doing the research and presenting this topic, I realized I wanted to do palliative care. And palliative care and especially oncology go hand in hand, because we know that patients with cancer who have early palliative care end up having better quality of life, better symptom control, better kind of psychosocial, emotional health, and actually may even live longer. I'm a researcher primarily, and with all research, we're dependent on funding. And so I think I am a good example of the importance of persistence in funding. And so I've hit different points in my life where I just felt like, well, the kind of peer review, they're just not that into me. They're not into what I'm doing. And I really struggled to get funding for the work I was doing. And I probably hit 3 points in my life where I really came very close to leaving research and pursuing just kind of a more straightforward clinical path. And then just at the last moment, something, because of persistence, because of like this continued effort to try to to try to write a better grant, to try to revise things and get funding, I was able to continue on this path of science. But I think for most of us in scientific research, to be able to communicate your passion for your work to others and get them as excited in what you're doing can be a real challenge. I think the lesson for my younger self is not to get disheartened by rejection, that to take all the feedback you can receive and integrate it to be a better scientist, construct more rigorous science, and that with persistence, eventually, all that hard work can pay off. I get a lot of motivation by the patients that I see on the clinical side. So I think so many of their stories have really inspired the work I'm doing, inspire the questions that I ask. For instance, in my current work in psychedelics, it was really inspired by a younger patient who asked me one time while we were following up, like, what is all this for if I'm sitting here dying at the end of my life alone, while my friends are all going on to have marriages and families and relationships and jobs, and I'm just here with my mom at my bedside, and what is the point? And that existential angst, that dread that he was experiencing, really gave me this kind of drive and desire to say, how can we do better for patients? How can we help them more through this really difficult to navigate problem? I'm a huge science fiction fan and kind of a nerd. And so one of the things that we've loved over the years and with some of my colleagues from our clinical team is to talk about issues that are relevant to palliative care, like existential distress or the idea of legacy and the importance of legacy. And we actually present those and tie them into current science fiction movies or shows, and we'll go all in, dress up, and present at the Comic-Con essentially in Denver. An idea that I think about a lot is that none of us are promised tomorrow. That we kind of live our lives like we have all the time in the world, when in fact things can change in a moment. And the appreciation of living a meaningful life and having kind of intentionality each day to be mindful in what we're doing, in the relationships that we have, in the work that we're doing is something that I think about a lot, and I think it drives a lot of what I do. You know, I think back a lot to when I was in residency training, and there were cancers like non-small cell lung cancer. And when someone was diagnosed with a non-small lung cancer that was metastatic, when I started training, their life expectancy was in months, not years. And thanks to science, thanks to the NIH and federally funded science, we have made incredible strides in cancer research. And I know right now a lot of people in science feel that there may be a change in the amount that the federal government is going to be willing to invest into cancer-directed research. And I would just like to say to the younger generation, stay with this. We need your new ideas. We need you to be a part of this journey. We need you to be part of the science. And, you know, I look at how far we've come, and I can't even imagine where we may be going. For that next generation, they're just going to be critical to be a part of that. And so my hope is that despite whatever we're seeing in funding towards scientific research, that we will continue to engage that younger generation and keep them involved in this effort. In about 2000, I was looking to, find a first place to live. And for some reason, I had this idea that I would live in the mountains and somehow commute in. I'm not sure what I was thinking, but at the time, my husband and I decided that we should continue to rent an apartment in Denver, but buy up in the mountains. And our friend convinced us that Leadville was the hub of Colorado. Now, most people would know Leadville is this like little tiny high altitude, old mining town. But you really have amazing access to the south and to the west and to most of the ski resorts. So we bought in 2000 a place up in Leadville. And that has been like the most treasured thing in our family since then, because we spend probably 2 to 3 weekends a month up in Leadville in the mountains. I cannot express to you like the importance that nature and being out in nature plays in our lives. In the summer, bike and hike, lots of hiking. And in the winter, this is probably like the favorite thing I have to do in the world is there's a loop, and I can either go 3 miles, 5 miles, or 8 miles on a cross-country ski kind of route. And it's absolutely quiet. If I see 5 people, that's like the equivalent of like the trail being mobbed, because it is usually just utter isolation and quiet and peace, and it's absolutely beautiful. Sometimes I'll see a moose. I see a ton of snowshoe hare tracks. They're really reclusive, so I think I can count on one hand the times I've actually seen the snowshoe hare itself, but their presence is everywhere, and just to be out there is just my happy place. Yeah. One thing that I'm just absolutely regimented about is kind of getting a little bit of exercise every day. And whether that's running or biking or yoga, or I like to do kettlebell weights, that helps me stay grounded. I've never been someone who is able to meditate, but I do think that mindfulness is really important. And so I've chosen a lot of most of my hobbies will require some degree of absolute utter concentration and mindfulness. So I've learned ceramic pottery or done taekwondo, and all these activities, I think they've been fun, but most important, the kind of connecting thread is that you have to be utterly immersed in what you're doing. And it allows that space to really clear your brain.